Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, immigration and the 2024 election. Dr. Kiara Álvarez is a psychologist and Bloomberg Assistant Professor of American Health at Johns Hopkins, and Dr. Sarah Polk is the medical director of the CentroSOL clinic at Johns Hopkins. They joined Dr. Josh Sharfstein to discuss the policy differences as well as the differences in rhetoric between the Trump and Harris campaigns. They also discuss the importance of congressional elections in achieving a bipartisan immigration solution. Let's listen.
Dr. Kiara Álvarez, Dr. Sarah Polk, thank you so much for joining me to talk about the issue of immigration in this presidential election and its implications for health. There's a lot of talk about immigration in this highly contested presidential election in particular. I want to ask you what comes to mind first when I say immigration election 2024. Dr. Álvarez?
Well, I think what comes to mind for me is certainly the extreme rhetoric from the Trump campaign regarding immigrants and regarding immigration, starting with the notion that there would be or could be mass deportation of 11 million people in the United States, which is something that we've never sort of seen or proposed at that scale. And as much as we may know logistically that is actually impossible, it is also something that, a weapon to really be used to sow fear and to really cause negative consequences for immigrants and for people of color in the U.S. generally.
Are you saying that this is, on the one hand, a policy proposal, but on another hand, a little more than that?
Absolutely. I think it's much more than that, because I think it goes against the very foundation, of what the United States is supposed to be as a country. It violates human rights, frameworks around being able to seek asylum, being in this country. And it very much impacts, when we see federal policy and federal rhetoric trickles down to the local level. And we know that there are places in the United States where law enforcement has really taken on the opening to be able to terrorize immigrant communities based on federal policies. And so once we move in that direction, I think there's really no coming back from that, from the impact of that has, on the fabric of the country and on communities.
Dr. Álvarez, how does the whole discussion of the Haitian immigrant community in Ohio play into what you're talking about?
Well, it's been a horrible thing that has happened in recent weeks. And it is really, I think, a very good example of how something that's completely preposterous and clearly, came from as a false kind of accusation, but was really used and weaponized by a political campaign that knew that what they were saying was ridiculous, and also knew it would have, very immediate consequences on the people being targeted, but used that as a way to gain support, for their party. And so in terms of the consequences of that, it's very concrete and real. We see that there were threats, to schools, threats of violence, closing down schools, and the impact that has certainly on Haitian children in that community, Haitian families, and also everybody in that community that is now under that fear of violence. We see the threats to businesses. We see the way that tears at sort of the social fabric of a community where immigrants had been welcomed and had been, and continue to make very important contributions to the community. And so, again, speaking to this notion that it really pushes against what I think we want to see in terms of healthy communities in the United States, there's this emphasis on division and on violence, towards community members.
Now, you are a mental health clinician. You work with immigrant communities. How are you seeing this level of rhetoric play out in the actual lives of people that you work with?
I think we see it at very real and high levels of fear and anxiety in families. Parents worried about the well-being and safety of their kids, children worried about their parents and whether they might lose their parents or be separated from them. I think we see it at the level of belonging. We know that feeling belonging to school, to community, to having that kind of external support is actually very important to youth mental health. That's one of the reasons, the CDC is now measuring feelings of belonging in their national surveys because of how important it is. this kind of rhetoric very much pushes for division and for lack of belonging, lack of feeling that you have a place in the community, not feeling like you have a future, which is another factor that we know is very protective for kids, is having a sense of a future orientation where you will be sort of successful and happy. And I would say that the other way that it takes place is that we actually know from research that feeling cultural pride, feeling a sense of pride in your history and your culture is very protective for youth of all backgrounds. And this kind of experience actually really pushes people away from that. In the past, I've had parents ask me, well, what do I do about making sure my kids no longer speak my language in public because I'm afraid that we might get attacked if we're on the bus and we're speaking in another language. And we know that that's very harmful, to children to view that their own cultural background, which we've historically seen as one of the benefits of the US, right? That we are, a place where people of all cultures and backgrounds come together, is something that they have to be fearful about or feel ashamed of.
And do you think that how this election turns out could make a big difference in those perceptions?
I do think so, because I think that we have to be able to move the needle back to a place of feeling hope around the direction that the country is going in, feeling a sense of community, feeling that there is a place for everyone here, that there's really a sense of, of prosperity, of a better future. And I think that the vision that we've been given and that we've seen play out, because we've had a prior Trump administration, was so stark, was so traumatic, and so just uniformly negative, that I think there is a big difference. I do think that there still has been such a focus, on border security as the key issue. And so we're not necessarily there yet as a country to really being able to talk about rebuilding sort of our perspective on the rights of immigrants and on the role of immigrants in the community. But I do think that we get a different window of opportunity to do that under a Harris administration.
Thank you. Dr. Polk, I'd like to turn to you. When you think about the health of immigrants and this election, what kinds of things are on your mind?
One thing I think about immediately is a return to the threat of the public charge.
The public charge, are you referring to the proposed public charge rule under the Trump administration?
Yes, it was proposed and not fully enacted, but it was still the threat of it was very harmful to families.
So tell me about that proposal.
The proposal was that for eligible U.S. citizen children of immigrants who were eligible for public health insurance and who use SNAP, that the use of those benefits would be held against their parents when their parents tried to apply for citizenship.
Great. I'm going to pause there for a second because you mentioned SNAP, which is the Supplemental Nutrition Assistance Program. It provides food. So we're talking about immigrant families with children who are U.S. citizens eligible for food assistance, and presumably they could benefit from food assistance?
Yes, we're seeing right now very high rates of food insecurity across the country in all communities, but we especially see this in immigrant families, and SNAP, a Supplemental Nutrition Assistance Program, has been proven over and over again to directly benefit children and their families.
So the children are eligible in order to get food, but the parents could be penalized if they get food for their children under this proposal that happened under the Trump administration.
Right. That was the threat under the Trump administration. And it's very quickly confusing because while the child is eligible because they're born in the U.S., the parents have to report information about themselves to the government and how much they earn. So it exposes the parents to being known by the state, even though it's a benefit that the child receives. And so it's a little bit complicated to begin with, and the threat of harm made it not worth it, although we know that having enough food in your house is highly beneficial to children and their parents.
So you were seeing families refuse food?
We were seeing families, and we continue to see, because there are myths and perceptions that we've never been able to recover from, we still see food insecure families without enough access to food, decline to participate in this food assistance program because they're afraid of its implications for the parental application for citizenship at some time in the future, which may or may never come.
And has the Biden-Harris administration continue to pursue policies like that?
There's been no mention or threat of acting on the public charge or limiting public benefit assistance for eligible U.S. citizens, children of immigrant parents, by the Biden-Harris or the Harris-Walz tickets campaigns.
So potentially that is a difference that we could see based on how the election goes.
Yes, I think Dr. Álvarez's comments about mass deportation are really top of people's minds, but adequate access to food and access to healthcare are also critical to the well-being of kids and families and represent a big difference between the two campaigns.
Thanks so much, Dr. Polk. Dr. Álvarez, I want to turn back to you and ask whether this election is all about the presidential election when it comes to immigration, or do you see an important role for what happens in Congress?
Absolutely, a very important role for what happens in Congress and for the balance of power there, in the sense that we were very close to an immigration bill, right? This is really where the country has fallen short, over decades, is really being able to pass comprehensive immigration reform. And that was something that we were very close to and did not get passed. And so being able to have a legislature that is focused on bipartisan solution is very important, but we have seen that fail over and over again.
And one of the consequences is you have all these people sort of in limbo.
Absolutely. And I think a good example of that is DACA, Deferred Action for Childhood Arrivals, which was really done, under the Obama administration, but has never been passed into law or any sort of permanency. And so we see this impact now for a very long time of this uncertain status, for youth who are now adults who have been in the country, most of their lives and are contributing in terms of education, in terms of the economy, in terms of their work, and still have no certainty about their outcomes because there hasn't been a solution to that by Congress and it hasn't been able to be passed.
Would it be fair to say, Dr. Álvarez, that there's so much attention to the harsh rhetoric about immigration and how much worse, in a way, things could be for immigrants under a Trump administration, that there really hasn't been very much discussion about what could make things better in terms of a comprehensive immigration policy?
Well, I think that it's a consequence of continued sort of catastrophes and catastrophizing, right, and things getting continually worse. There were so many terrible things that happened, under the Trump administration, such as the family separation, which is still, efforts to try to undo the effects of that. I mean, impossible to undo entirely, but I think that has really put everything in this defensive status as opposed to, yes, really shifting the perception and shifting the focus to what we can do as a country to make life better for immigrants, certainly, but also make it a better country overall, a country that really does live up to its promise to be multicultural, to be welcoming to people from all backgrounds, and to integrate that into the fabric of what it means to be American.
Well, Dr. Álvarez, Dr. Polk, thank you so much for joining me to talk about this topic today.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.